We use them to keep in touch, to play, and to work. Now, your smartphone can help you limit the spread of COVID-19. Someone can have COVID-19 and not know it. They can spread the disease before they have any symptoms. The Government of Canada has developed an app that will let you know if you may have been in contact with someone who has tested positive for COVID-19. The COVID Alert app creates a random code so that no one will know your name or your location. The app uses Bluetooth to exchange random codes with nearby phones. The code is a randomly generated string of digits and letters that changes every 5 minutes, so it cannot be used to identify you. The app does not have access to your name or address, or your phone's contacts, your location, or your health information. If someone you've encountered later tests positive for COVID-19 and uploads to the app a one-time key they received from their healthcare authority, you'll be notified that you may have been exposed. If you test positive for COVID-19, you can upload your one-time key from your healthcare authority. The app will then notify the people you've encountered without revealing your identity. You can then take steps to limit the spread of the disease. If you know you've been exposed, you should contact your local public health authority and follow their instructions. Using the app is one more thing we can all do to help limit the spread of COVID-19, in addition to washing our hands, keeping 2 meters apart, and wearing a non-medical mask or face covering when it's difficult to maintain physical distancing. You can do your part by downloading the app today and helping others use it too. The more people who use the app, the better we can contain COVID-19. Help protect yourself and your community. Download the COVID Alert app to help limit the spread of COVID-19. Go to the App Store or Google Play. Find out more at canada.ca/coronavirus. A message from the Government of Canada.
Les habla Óscar Avendaño de Exploring Solutions Canada. Quiero compartir con ustedes que hemos incluido un nuevo servicio para ti: financiamiento de vehículos nuevos y usados. Sí, escuchaste bien. Enfocados en ti, nuevos inmigrantes, estudiantes internacionales o cualquier residente ya establecido con o sin crédito. Toda situación migratoria será atendido. Por favor, llámanos al 905-920-2143 y comienza a conducir tu carro ahora.
Bonjour tout le monde. Hello, everyone.
Good morning, everyone.
Over the weekend, we've seen Ontario, Saskatchewan, New Brunswick, and Alberta all report new single-day highs of COVID-19. Just yesterday, PEI and Newfoundland and Labrador left the Atlantic bubble as cases increase on the West Coast. And a few days ago, our government approved a request for assistance to deploy in a long-term care home in the Opaskwayak Cree Nation in Manitoba. As they always do, our brave women and men in uniform are stepping up again to support Canadians and help provinces get the situation under control. The cases we are seeing are extremely concerning, and the federal government will continue to be there for people and small businesses every step of the way. As of yesterday, applications opened for the newly launched Canada Emergency Rent Subsidy. If you own a small business, you could get up to 65% of your business's rent covered, and that goes directly to you, not through your landlord. If your community is in lockdown, we're adding an extra 25% help for commercial rent through the new lockdown support. Combined with the rent subsidy, you could have up to 90% of your rent covered. To help with another big expense for business, payroll, the wage subsidy has also been extended until June of next year. These programs are just some of the many measures we've introduced to have the backs of business owners and workers alike through this second wave. Go to canada.ca/coronavirus to find out what supports are there for you. We know that this second wave had the potential to get really serious really fast. And we also knew that we had to be ready to do whatever it takes to get it under control. Because at the end of the day, lives are at stake. I know you get that. I know you're worried about the people around you. Last Tuesday, I got an email from Jackie in Edmonton. Jackie's worried about her husband who works in the school system. She's worried about her grandparents and parents-in-law who are in long-term care homes. She's worried about her kids. Jackie, I hear you. You're right. This is a tough time. And I want you to know that you're not in this alone. Our government's top priority is to keep Canadians safe. That's why every step of the way, we've been supporting the provinces so that they can make the right decisions for you. Our supports for businesses and for people mean that local officials don't have to choose between people's health or the economy. And we've been supporting with supplies as well. As of last week, we've sent over 300,000 rapid tests to Alberta and 444,000 face masks. The federal government has also provided $1.3 billion to the province for everything from PPE to contact tracers through the Safe Restart Agreement, with another $260 million for schools in Alberta through the Safe Return to Class Fund. And that's just some of the support we've made available for people and businesses in Alberta, just like for everyone across the country. No matter where you live, we will continue to be there for you through this second wave and beyond. Notre principale priorité est encore d'assurer
Our main priority is ensuring Canadians' safety, whether that means buying more PPE, increasing contact tracing, or investing in research. That is what we are working on. Since last week, we have provided over 2.9 million pairs of gloves to provinces and territories, and more is coming. We also sent 4.6 rapid tracing tests, and millions of more are on their way. People need these tests, and they need this essential assistance out in the field. We're going to continue to do our part and provide them with the material they need over the coming months and weeks. It is essential to purchase and distribute PPE and rapid tracing tests, but it's also important to find a vaccine that is safe and effective if we are to conquer COVID-19. No later than yesterday, we got promising news about the AstraZeneca Oxford vaccine. Canada has already negotiated an agreement to receive up to 20 million doses. That vaccine is part of our spectrum of potential vaccines for Canadians. When we do have a vaccine, the right material to administer it will also be essential. Up till now, we have received over 24 million syringes and needles, and others will be delivered every week. This is all part of the strategy we set up to be ready when the vaccine is ready. We know that not everyone will be vaccinated at the same time. We're going to have to establish some priorities. But everything we're doing now is going to help us vaccinate Canadians as quickly as possible.
To keep Canadians safe, we need access to as many potential vaccines and treatments as possible. Today, I can announce that we've signed a deal to secure up to 26,000 doses of a therapeutic drug from Eli Lilly, with options for thousands more. This treatment was developed in partnership with Vancouver's Abcelera Biologics and is part of our support for researchers right here at home who are working around the clock to find a treatment for COVID-19. So to the scientists and researchers across the country, thank you for everything you do. Just like always, your dedication and expertise is making Canadians healthier and safer, and is building a better tomorrow. Canada is lucky to have thousands of world-class scientists and researchers. As a government, we will continue to be there every step of the way to support you in the work you do. Aujourd'hui,
today, I can tell you that we have negotiated an agreement to reserve up to 26,000 doses of an Eli Lilly therapeutic, with the possibility of receiving thousands more. This treatment was developed in partnership with AbCellera Biologics in Vancouver, including partly thanks to the support we offered researchers that are working hard to find a treatment right here in the country. We're going to continue to support our researchers and our scientists who spare no effort to find a safe and effective treatment against this virus. I wish to thank them for everything they're doing for their country and for the whole world.
The news about promising vaccine candidates that we've heard in the past few days is reason to be hopeful. Our government has worked hard to secure tens of millions of doses, so we're prepared once a safe, effective vaccine is ready for Canadians. But we cannot be complacent now. Remember, if you catch COVID-19 this week, a vaccine in the coming months won't help you. We've seen restrictions increase across the country over the past few days, and Canadians are taking extra care to stay home. But I want to remind you, nothing that we do today will bring the numbers down this week. This week's numbers were already determined by behaviors last week and the week before. What we can affect today is what our country looks like a week, 2 weeks from now. So continue doing your part to keep yourself, your family, and your loved ones safe. Stay at home, wear a mask, avoid social gatherings, especially indoors, and don't forget to download the COVID-19 app. It's easy, free, and quick, and it's incredibly powerful. Just ask Sasha from Toronto. Sasha downloaded the app, and 2 weeks ago, it notified him that he'd been exposed to someone who tested positive for COVID-19. Sasha always wears his mask, sanitizes everything, and felt just fine. But he did the right thing and went in to get tested. Well, the test came back positive. He'd been asymptomatic the whole time. If Sasha hadn't had COVID alert, he would never have known. But because of the app, he found out and then was able to self-isolate and keep other people safe. He and his family are almost done their self-isolation, and they've said that they want everyone to know about their story so that as many people as possible use the COVID Alert app. To Sasha and his wife, Kate, thank you for doing the right thing in getting the app, getting tested, and then staying home. And thank you for sharing your story to encourage even more people to make the smart, responsible choice that you did. The more people download this app, the stronger it becomes. So join the over 5.4 million Canadians who, like Sasha, have downloaded the COVID Alert app. Plus les gens téléchargent cette application,
it becomes. So join the over 5.4 million Canadians who, like Sasha, have downloaded the COVID Alert app. Yesterday, I had the opportunity to speak with students from the St. Martha Catholic School in Kingston, Ontario, with our local MP, Mark Garretson. I would like to conclude today by directly speaking to teachers and support staff who help us educate our children during this crisis. I know this year has been difficult. I know you're going to continue to do everything you can to help our children, to educate our children. But it's really not easy. You're placing yourselves at risk, but you're going beyond everything to support our children and their parents. Thank you. I know what kind of commitment that requires. I know what you're doing as teachers. I know what you do as teachers, and I assure you that all Canadians are profoundly grateful to you. Please continue your excellent work. Continue to be there for us, as we will be here for you. Thank you. I would be pleased to take your questions now.
Prime Minister, we'll start on the phone with questions. One question, one follow-up. Operator.
Thank you. First question, TVA. Question. Hello, good morning, Prime Minister. When it comes to vaccines, your government talked about the first quarter of 2021, but other countries like the U.S. are talking about possibly having a vaccine even at the beginning of December. Can you please tell us when it's going to begin in Canadians, and what can you tell Canadians who are thinking they're going to see Americans being vaccinated before we are? Answer. As people may know, we do not have mass production capacity for vaccines in Canada. We did decades ago, but since that time, we no longer have domestic capacity. Other countries that do, such as the United States, Great Britain, Germany, and others, of course, are going to prioritize access to vaccines for their own citizens first. But that is why our government did two things. Firstly, we are investing to redevelop a pharmaceutical industry here in Canada so that we can produce vaccines in the coming years, especially if ever there is another pandemic such as this one. We won't be caught short-handed as we did this time. And secondly, that is why we worked so hard to ensure that Canadians and Canada would have access to a vaccine. So we signed more agreements for more vaccines, for more millions of doses than practically any other country. And we will be here to ensure that Canadians do receive vaccines. We are working with those companies, with partners, to ensure that we receive them as quickly as possible, because we know we're not going to get through this pandemic without a vaccine, and we're working on it.
I think one of the things to remember is Canada no longer has any domestic production capacity for vaccines. We used to have it decades ago, but we no longer have it. Countries like the United States, Germany, and the UK do have domestic pharmaceutical facilities, which is why they're obviously going to prioritize helping their citizens first. So Canada did two things over the past months. First of all, we've begun to invest once again in ensuring that Canada will have domestic vaccine production capacity, because we never want to be caught short again without the ability to support Canadians directly, and that will be in place in the coming years. If ever there is another pandemic, we will not be caught on the wrong foot again. But secondly, that's why, recognizing the challenges we had around getting vaccines from other countries to Canada, the Canadian government signed a record number of agreements with vaccine producers, potential vaccine producers around the world. We have reached out and have actually one of the very best vaccine portfolios of any country around the world, with far more doses for Canadians potentially than we actually have Canadian population. That's because we don't know which vaccines are going to be most effective, which ones are going to arrive early, but we have done everything we can to ensure that Canadians get these vaccines as quickly as possible and as effectively as possible. But of course, in all cases, we are in for, as a world, a number more months where we have to do everything to keep our cases down before vaccines get here, so that we are able to get through this as best as possible, which is why people need to continue to stay safe and limit the spread of COVID-19.
A follow-up question? Yes. With respect to the French language, Quebec is going to announce its intention to have its businesses follow Bill 101. Last week you said that you supported what Bill 101 was doing in Quebec. Are you going to allow that to happen at the federal level as well? We're going to see what's going to be necessary to protect the French fact in Quebec and everywhere else in Canada too. We've always cared about protecting the use of French and protecting official language minority communities across the country. We are going to take a look at Quebec's proposals. I think it's important to emphasize how much we wish to work hard to protect French. That's what we've emphasized in the speech for the throne, in the throne speech, and we're going to take a look at Quebec's proposals and make our own decisions afterwards.
Thank you. Merci. Next question, Ryan Tumulty, National Post. Line open.
Yeah, sir. Also on the vaccine front, there's been some confusion about exactly when your government will be ready to distribute vaccines. I know you can't say for sure when you'll actually have them, but when will the government be ready to distribute those vaccines to provinces and territories, and will the military be involved in that distribution?
I think everyone is rightly focused on vaccines because we know that without a vaccine, we don't get through this pandemic. And we are looking forward to being able to vaccinate Canadians in the coming months. We know that in order to know exactly which vaccines are going to be effective, we're going to have to watch the trials carefully. We're going to have to see the approvals process. We're going to have to set up logistical streams to be able to deliver those vaccines to Canadians. And those are all things that we're working on right now. But one of the reasons why we signed a range of agreements for vaccines with many different companies is because we know that not all vaccines are going to be equally effective. Some may face challenges around production and delivery, and we wanted to make sure that we were covering all the bases to ensure that Canadians would get them as quickly as possible and have them be as effective as possible. So we are working with a number of partners, including the Canadian military, to ensure that as soon as vaccines arrive and are deemed safe, they will be distributed to Canadians. We're making sure that we have the plan in place to move as quickly as possible, but it is premature to start, crossing out, circling dates on a calendar or saying that this vaccine is going to arrive in this amount on this day in this community, because there's still a lot of work to do between now and then. But we're on it, just like we've been on every element of protecting Canadians in this pandemic. I
think I understand why people wish to know more about vaccines as quickly as possible. It's like at the beginning of this pandemic, everyone wanted to know when we were going to lift restrictions during the first wave. People want to know when will these vaccines will arrive, when we can get back to normal. The reality is there are quite a few potential vaccines, but we do not know which one will be the most effective, which ones will arrive first, when we will be able to deliver them directly to Canadians. And that's why we are currently implementing a robust plan to mobilize our resources so that we can deliver vaccines to the right people as soon as they arrive in Canada and are deemed safe for Canadians. So we have a plan. We are delivering on that plan, but there is work that remains to be done before the vaccines arrive and are distributed.
What you're saying about not being able to circle dates on a calendar because we don't know exactly when the vaccines are going to arrive or how effective they're going to be, but doesn't it make sense to have a specific date or a specific timeline in place when you'll have your rollout plan ready to go? Whether or not the vaccine is here yet, but you have the logistics ready to go to handle the vaccine. Say it should arrive earlier than we're expecting.
We are working very closely with the provinces, with partners, including the Canadian military, to establish that logistical mobilization plan, and we will have more to share as we get it up and running.
Thank you. And we'll take one more call on the line. Operator.
Thank you. Merci. Prochaine question, l'inaudible.
The next question is from Canadian Press. Go ahead. Question. Hello, Mr. Trudeau. I also would like to come back to the issue of vaccines. I didn't quite understand your explanation for my TVA colleague. You're saying that it's normal for Canadians that can produce vaccines prioritize their own populations. So are we to understand that the contracts you negotiated to buy millions of doses, and you're saying saying that we will, does that mean that we'll only receive those millions of doses after the Americans or the Germans or whomever, depending on the pharmaceutical company that sold it to us, will have received theirs? Answer, absolutely not. No, we will we will receive doses in the first months of the coming year. But the very first doses, and that's understandable, an American pharmaceutical company will begin to distribute in the U.S. before they distribute internationally. But we don't have to wait for everyone in the U.S. to be vaccinated before we begin to vaccinate Canadians. We will be receiving vaccines in the coming months, even while they are distributing them across the U.S. and elsewhere in the world.
Yes, the very first vaccines that roll off an assembly line in a given country are likely to be given to citizens of that particular country. But shortly afterwards, they will start honoring and delivering on the contracts that they signed with other countries, including with Canada. We've secured millions of doses of the vaccines, of the various vaccine candidates around the world, and we're expecting to start receiving those doses in the first few months of 2021.
Follow-up question? Yes, thank you. Friday, you were asked if you were angered or unhappy to see that Mr. Legault was allowing people to gather from December 24th to 27th. You were saying, and you said, no, it's fine. He can do as he wishes. And then Dr. Tam this morning said that gatherings over the holidays should only be done with members of one's own household. Can you explain the contradiction between what you said Friday and what the federal authorities are saying today? Answer. What we're always saying is to listen to listen to your public health, your local public health directives. Of course, directives are going to be different at the Atlantic bubble from those that they will give in Montreal or that one might hear in Alberta or BC. But at the same time, we are trying to guide people as much as possible using the best recommendations we have to offer. And that is why Dr. Tam is establishing principles that shouldn't really surprise anyone, that as much as possible, people should stay at home, they should avoid gatherings and social contact with people. Now, different jurisdictions are going to make their own specific decisions, but recommendations will always apply everywhere to be careful over the coming months, because we must massively reduce this outbreak of COVID-19.
Hi, Prime Minister. It's Annie Bergeron-Oliver from CTV National News. I'm also going to go back on vaccines. I'm just wondering, what guarantees do you have from the pharmaceutical companies as well as from our allies that the delivery of vaccines to Canada will not be significantly delayed because of mass vaccination programs in other countries who've approved these vaccines first? And also, will Canada start receiving shipments before the vaccines themselves are approved in Canada so that they can get out to Canadians?
We have signed strong contracts with various vaccine companies, and we are working closely with allies on ensuring that there is a free flow of delivery of contracts. We know that this is a preoccupation that many people have, which is why it was something that we all talked about on this weekend's G20 virtual summit. It's really important to ensure that everyone gets access to vaccines around the world, because no one place gets through COVID-19 until all places are done with COVID-19. In regards to the question on vaccines arriving, we are working as quickly as possible with the data that vaccine companies are providing us to ensure that approval of these vaccines happens rapidly, so that there is no delay between them arriving and being distributed to Canadians. But we will not cut any corners when it comes to protecting Canadians' safety. We're looking very carefully at what our allies are doing in terms of approval of various vaccines, but at the same time, we know how important it is that as many people as possible get these vaccines, which is why we need to guarantee to Canadians that they will be safe for them, so as many people as possible will get the vaccines. Okay.
I think we all understand that it's important to be able to have vaccines available everywhere in the world, because no place can get through COVID-19 if everyone isn't getting through COVID-19. That's why we're trying to ensure that these contracts are respected, and we are working with our allies to that end, and we are confident that there will be no interruptions in that respect. At the same time, it's very important to ensure that those vaccines are approved for use as soon as they arrive in Canada so that they can be distributed. That's why we're working ahead of their delivery so that we can ensure their safety and efficacy. And Health Canada is currently analyzing all data provided by the companies in making their decisions. And we're also looking at what our allies are doing in that regard. However, I'd like to reassure Canadians that if a vaccine begins to be distributed in Canada, it is because we have deemed it safe for Canadians. We need people to feel confident and know that they are safe when they take that vaccine. That's exactly the work that we are doing to ensure
Canadian press. You've criticized the opposition for suggesting that you're somehow using this pandemic as cover for major changes to Canadian society, the economy. And you've also talked about the importance of building back better. Meanwhile, we're seeing big changes, accelerations in how we're living, moves towards things like online shopping, while local merchants say they're suffering. So how do you balance supporting people through COVID-19 with what you say is this need to come out with a country that's going to be different than it was before?
I think we're learning lessons through this pandemic about how important it is to be there for each other, to support each other. I think we're learning lessons about how important it is to support a digital transformation of our economy, while at the same time we're making sure that small businesses benefit from it. I think we're learning through this pandemic that vulnerable people who are always falling through the cracks need more supports than we've been able to give them up until now. These are things that are obvious during this pandemic that I think Canadians expect the government to respond to. So, like I said, we will be there every step of the way to do whatever is necessary to support Canadians through this pandemic. And we will continue to work with Canadians to ensure that when the economy comes roaring back at the end of this pandemic, it does so in a way that benefits everyone.
Good afternoon, Prime Minister Marc-Andre Cossette with Global News. The United States, Germany, and the United Kingdom have all said that they could start vaccinating their populations as early as next month. Spain plans to have more than 10 million of its citizens vaccinated by March. You've talked about distributing the vaccine to high-priority Canadians in the first 3 months of next year, but compared to these other countries, how much longer will average Canadians have to wait to be vaccinated?
We have secured tens of millions of doses of many different types of vaccines, exactly to ensure that we're able to vaccinate as many Canadians as possible, as quickly as possible. We recognize the disadvantage that Canada has of not having a domestic pharmaceutical industry able to mass produce vaccines. But that's why we went above and beyond in securing access to more doses per capita than just about any other country of the potential vaccines out there.
Hi, Prime Minister. Tom Perry with CBC. You know, we saw in the first wave that it was the Wild West when it came to Canada getting PPE, other countries as well. And I'm wondering if this time you're talking about us securing these vaccines, but have you got assurances from our allies, from the pharmaceutical companies, that there's not going to be, say, export controls on these vaccines once they're produced that's going to get in the way of Canadians getting these vaccines?
We obviously learned a lot and had certain challenges on delivering PPE in the spring, because it was, as you say, a real challenge and lots of global competition, which was why at the same time as we managed to deliver massive amounts of PPE to Canada, we developed domestic industries at the same time. So we have made in Canada solutions. At the same time, we worked with our partners to ensure that when we saw challenges around delivery of 3M products, for example, we worked closely with the United States to emphasize the integration of our supply lines that flow back and forth across the border and ensured that essential supplies continue to be delivered. As a world, we are very aware and discussing the challenges around the necessity for free flow of goods across the borders, particularly medical supplies and vaccines. It was a topic of discussion this weekend at the G20, and we've all committed and understood that no one place gets through this pandemic until all of us get through this pandemic, and I'm confident that we're going to be able to access the necessary vaccines for Canadians.
Hello,
Mr. Trudeau, Radio-Canada. Concerning Huawei in Canada, our allies and the Five Eyes have already made a decision on the 5G networks. We know that your government have been thinking about this for about a year. So what are you lacking in making a decision about Huawei in Canada? Answer. Our security agencies are assessing the situation, are analyzing, looking at the situation in order to make the right recommendations to government. So we continue to work with them, and we will listen to their recommendations when they're ready to give them.
Our intelligence communities and services are looking carefully at the question around 5G and Huawei. As they firm up their recommendations and make them to the government, we will move forward.
Question. Are you afraid that there will be an impact on the two Michaels, for example? Answer. We're always concerned about the situation of the two Michaels that have been arbitrarily detained in China. We will continue to do everything that is necessary to bring them back to Canada and to push back against China's form of coercive diplomacy.
Concerned about the two Canadians arbitrarily detained in China. We will continue to do everything necessary to bring them home and continue to push back against China's coercive diplomacy. Merci tout le monde. Bonne journée.
Thank you, everyone. Have a great day.
We use them to keep in touch, to play, and to work. Now, your smartphone can help you limit the spread of COVID-19. Someone can have COVID-19 and not know it. They can spread the disease before they have any symptoms. The Government of Canada has developed an app that will let you know if you may have been in contact with someone who has tested positive for COVID-19. The COVID Alert app creates a random code so that no one will know your name or your location. The app uses Bluetooth to exchange random codes with nearby phones. The code is a randomly generated string of digits and letters that changes every 5 minutes, so it cannot be used to identify you. The app does not have access to your name or address, or your phone's contacts, your location, or your health information. If someone you've encountered later tests positive for COVID-19 and uploads to the app a one-time key they received from their healthcare authority, you'll be notified that you may have been exposed. If you test positive for COVID-19, you can upload your one-time key from your healthcare authority. The app will then notify the people you've encountered without revealing your identity. You can then take steps to limit the spread of the disease. If you know you've been exposed, you should contact your local public health authority and follow their instructions. Using the app is one more thing we can all do to help limit the spread of COVID-19, in addition to washing our hands, keeping 2 meters apart, and wearing a non-medical mask or face covering when it's difficult to maintain physical distancing. You can do your part by downloading the app today and helping others use it too. The more people who use the app, the better we can contain COVID-19. Help protect yourself and your community. Download the COVID Alert app to help limit the spread of COVID-19. Go to the App Store or Google Play. Find out more at canada.ca/coronavirus. A message from the Government of Canada.
Les habla Óscar Avendaño de Exploring Solutions Canada. Quiero compartir con ustedes que hemos incluido un nuevo servicio para ti, Financiamiento de vehículos nuevos y usados. Sí, escuchaste bien. Enfocados en ti, nuevos inmigrantes, estudiantes internacionales o cualquier residente ya establecido con o sin crédito. Toda situación migratoria será atendido. Por favor, llámanos al 905-920-2143 y comienza a conducir tu carro ahora.